Hi class, we're going to try doing a video recording of this lecture, and we're going to talk about soft tissue injuries today. Again, it is your responsibility to supplement your learning today with reviewing additional materials, maybe from the book, and going back and reviewing this PowerPoint also. So overall, soft tissue injuries, a lot of people have them. I'm sure each one of you have had a soft tissue injury before, and some of them are more severe, others not so much. A laceration needing a band-aid, that's a soft tissue injury. A paper cut is a soft tissue injury, and so there's lots of different reasons for a soft tissue injury. So some of them being falls, if somebody is involved in a motor vehicle crash, if somebody is hit with blunt force trauma, or if there's even penetrating trauma through a gunshot wound, a stab wound, some sort of impalement, that is going to cause trauma to the soft tissue. It's been a long day. So overall, most people survive their soft tissue injury. However, about 70,000 people are killed each year from their soft tissue injuries. So it's definitely something that you should be aware of whenever you're treating your patients as a potential to cause harm to the patient. So the epidermis is that outer layer of skin that you should keep in mind. It's made up of, you can call it old skin, but it's constantly being sloughed off. It is supposed to be waterproof, and so that keeps our fluid in, keeps fluid out, and it is one of the first layers of defense whenever it comes to pathogens. So it does have chemicals in it to help keep germs away. Below the epidermis is the dermis. Remember, epi meaning upon, so epidermis was the other picture. This is the dermis, and so this is going to have a lot of the components that you think of whenever you think of skin. So hair follicles, glands, sebaceous and sweat glands, sensory nerves, pressure nerves, pain nerves, muscles are even in the dermis. Those erector pili that help make your hair stand up. And again, various blood vessels are going to be in there, varying in size too. Not too big, not like an artery, but definitely some blood vessels in there. Below the dermis is going to be the hypodermis, or the subcutaneous tissue. And this adipose tissue is going to be critical in providing insulation to keep you warm, protect you from any type of blunt force trauma, maybe even penetrating trauma, and acts as an energy reserve. Again, this could be a site for a subcutaneous medication administration, and it is a form of connective tissue. It's going to keep your skin where it's supposed to be and not wandering around. So as we've talked about before, we have hemostasis going on. We've got four components of hemostasis. Hemo meaning blood, stasis meaning stopping of that blood or stopping of the bleeding. And our hemostatic agents are going to be vasoconstriction. So our blood vessels are going to constrict for about 10 minutes after an injury has occurred, and this is going to occur immediately. I'm going to go back to the other picture of the dermis itself, and keep in mind these blood vessels here, these are the ones that are going to start vasoconstricting whenever we have hypoperfusion going on and we constrict blood vessels and the skin looks pale or ashen. These are the blood vessels that are getting constricted and blood is not going to them. So again, it's going to start immediately. Vasoconstriction is a part of hemostasis. Vasoconstriction, a part of hemostasis. The next part that usually happens pretty quickly along with that vasoconstriction, it's not like they're individual steps, but they're all going on about the same time, is the platelet plug that starts to form. So these platelets are going to aggregate together, they're going to start clumping together, and they're going to occlude these smaller blood vessels to keep blood from flowing out downstream. It's a quick little patch, nothing too significant, and this is why we allow permissive hypotension, to allow this platelet plug to set in, and even the clot here in this next step. This should be all material that you are familiar with. And again, these platelets are going to start sticking together to form that platelet plug, And if the platelet plug is continued to allow to form, if the injury is that severe, we have this thing called a coagulation cascade. The coagulation cascade will occur, and we will be forming our clots, our actual blood clots. That is going to be even more crucial in stopping more severe, more major bleeding. The platelet plug, the vasospasm or the vascular spasm with vasoconstriction, along with the clot that starts to form, is all going to work together and in conjunction with direct pressure to these wounds. Now the cascading event, or the coagulation cascade, that we are going to focus on is that last little part, the last few steps. There's a whole bunch of other steps involved here, various factors, and again, it's a constant balancing act from having too much clotting to not enough clotting, so it's always being balanced in our body. But the part that you need to know for our class is how prothrombin activator meets up with prothrombin and essentially gets rid of that first part and turns it into thrombin. And that thrombin is allowed to go around, and it converts fibrinogen into fibrin. And that's the key last step, is that fibrin is going to allow for fibrin threads and a grouping together, a little mesh net of cells to form an actual clot. And again, these are clotting factors that you might hear of from time to time. But this is what actually forms that blood clot, that last little step in the coagulation cascade, allowing for the clot to take a hold. And this clot is going to be sitting there in those blood vessels, occluding the blood flow to that area. And again, clots are good, so it's biological and a chemical process. It's also a physiological process with the vascular spasm occurring, going to be shunting the blood flow. So all these things working together is going to hopefully stop bleeding. If it's not working, if it's still bleeding, throw in some direct pressure, and that should do the trick. So this should all happen in less than 30 minutes. Now, another part of hemostasis is fibrous tissue that's going to be aimed at repairing it. This is your scar tissue. So it's going to help repair the wound and get it back to where it was, or make it even stronger than what it was before. And it's going to be generating new tissue through these fibroblasts. Remember that building anything is a blast. And we're going to have collagen synthesis, laying down that collagen, those collagen proteins, to form a new matrix. So scar tissue formation can occur, and it can lead to the following two types of scars we'll talk about here in a little bit. We'll get there, but they're called hypertrophic scars and keloid scars. So hemostasis is generally a good thing. However, sometimes it can be interfered with through, like we've mentioned before, not in this lecture, but other lectures, how different medications, so anticoagulants, aspirin, can interfere with the clotting process, and various diseases, so whether they be genetic, like hemophilia, can interfere with the clotting process. However, it's generally a good thing that the clotting process occurs, and however, if it occurs in a small area, a small blood vessel, like in the heart, we get a lot of aggregation of platelets, we can have what's called a heart attack. Or you can have a stroke potentially if it happens in the brain. So whenever it occurs in small areas, it's not necessarily a good thing. Alright, I'm going to pause it here, and we'll pick up with the next part.